Hello viewers, welcome to Learning Lane. Today we are going to see diphtheria, a serious bacterial infection, haunts us with its potential severity. This contagious disease primarily afflicts the nose and throat, posing a significant threat to unvaccinated individuals. The culprit behind this illness is a bacterium named Corynebacterium diphtheria. Let's delve into the microscopic world to understand this bacterium better. Corynebacterium diphtheria is a rod-shaped bacterium classified as a gram-positive bacillus. What makes it intriguing under the microscope is its unique arrangement. The bacteria often group together in a pattern resembling Chinese characters, adding a layer of complexity to their appearance. Another distinctive feature is the presence of metachromatic granules within the bacterial cells. These granules, composed of stored phosphate, appear as deeply stained beads when treated with specific dyes. The arrangement and granules serve as valuable markers for identifying Corynebacterium diphtheria in laboratory settings. Understanding the morphology of this bacterium is crucial in comprehending the disease it causes. By recognizing these microscopic characteristics, scientists can differentiate Corynebacterium diphtheria from other bacteria. This identification is vital for accurate diagnosis and effective treatment of diphtheria. Armed with this knowledge, let's move on to understand how this bacterium wreaks havoc within the human body. The real danger of Corynebacterium diphtheria lies in its ability to produce a potent toxin. This toxin, aptly named diphtheria toxin, is the main weapon in the bacterium's arsenal, causing widespread damage within the human body. The process begins with the bacterium colonizing the mucous membranes of the respiratory tract. Once established, Corynebacterium diphtheria releases the diphtheria toxin into the surrounding tissues. This toxin targets cells by interfering with their protein synthesis, effectively shutting down their vital functions. The body's response to this cellular assault is the formation of a thick gray membrane called a pseudomembrane. The pseudomembrane, composed of dead cells, fibrin, and inflammatory cells, forms over the infected area, typically in the throat or nose. This membrane can obstruct the airway, leading to breathing difficulties. Moreover, the toxin can spread through the bloodstream, affecting other organs including the heart, kidneys, and nervous system. The systemic effects of diphtheria toxin are what make this infection so dangerous. Damage to the heart can lead to myocarditis, a potentially fatal inflammation of the heart muscle. Nerve damage or neuropathy can cause paralysis, difficulty swallowing, and other neurological problems. Understanding the role of diphtheria toxin is crucial in grasping the severity of this disease. Diphtheria presents a range of symptoms, varying in severity from mild to life-threatening. The incubation period, the time between exposure and the onset of symptoms, typically ranges from 2 to 5 days. Initial symptoms often mimic those of a common cold, including sore throat, low-grade fever, and swollen lymph nodes in the neck. As the infection progresses, the hallmark sign of diphtheria emerges, a thick gray coating on the back of the throat, known as the pseudomembrane. This membrane can extend to the tonsils, uvula, and even the soft palate. Attempts to remove the membrane often result in bleeding. Breathing difficulties, hoarseness, and a barking cough are also common symptoms, particularly in children. In severe cases, the toxin can invade the bloodstream, leading to systemic complications. Myocarditis, a serious inflammation of the heart muscle, can manifest as rapid heartbeat, chest pain, and heart failure. Neurological complications, such as paralysis of the muscles involved in swallowing or breathing, can also occur. Recognizing these symptoms early is crucial for prompt medical attention and effective treatment. Section 4. Unmasking the culprit. Diagnosis and investigations. Diagnosing diphtheria relies on a combination of clinical evaluation and laboratory testing. A thorough medical history, including vaccination records, is essential. The doctor will examine the patient's throat for the characteristic pseudomembrane and assess the severity of symptoms. However, clinical examination alone is not sufficient for a definitive diagnosis. Laboratory tests play a crucial role in confirming the presence of Corynebacterium diphtheria. A throat swab is collected and sent to the laboratory for analysis. The sample is cultured on special media to grow the bacteria, allowing for identification based on their morphology and biochemical characteristics. Additionally, toxin detection tests are performed to confirm the presence of diphtheria toxin. These tests typically involve detecting the toxin's effect on cells in a laboratory setting. Early diagnosis is crucial for initiating prompt treatment and preventing the spread of infection. The combination of clinical findings and laboratory confirmation provides a definitive diagnosis of diphtheria, guiding appropriate medical intervention. Section 5. Combating the disease, treatment and management of diphtheria. Treating diphtheria requires a two-pronged approach, neutralizing the toxin and eliminating the bacteria. Diphtheria antitoxin, a life-saving medication, is administered to counteract the effects of the toxin. This antitoxin, derived from horse serum, binds to the toxin, preventing it from causing further damage. The earlier the antitoxin is given, the more effective it is in reducing the severity of the disease. Antibiotics, such as penicillin or erythromycin, are prescribed to kill the Corynebacterium diphtheria bacteria. These antibiotics help clear the infection and prevent the further production of toxin. Patients with diphtheria typically require isolation to prevent the spread of the disease. Supportive care, including bed rest, fluids, and airway management, is crucial, especially in severe cases. Complications such as myocarditis or neuropathy require specific treatment depending on their severity. Early administration of antitoxin remains the cornerstone of diphtheria treatment, significantly improving outcomes. Alongside antibiotics and supportive care, prompt treatment can be life-saving, preventing long-term complications. Section 6. Shielding ourselves. Prevention is the best cure. Preventing diphtheria relies heavily on vaccination. The diphtheria vaccine, typically combined with tetanus and pertussis vaccines or DTaP, provides highly effective immunity against the disease. The DTaP vaccine is administered as a series of 5 doses during childhood, with booster doses recommended throughout life. Maintaining high vaccination rates within a population is crucial for achieving herd immunity. Herd immunity occurs when a significant portion of a population is immune to a disease, making it difficult for the disease to spread. This protection is especially important for individuals who cannot be vaccinated, such as infants or those with medical contraindications. Public health measures such as early detection and isolation of cases are vital in controlling diphtheria outbreaks. Contact tracing, identifying and treating individuals who may have been exposed to the infected person, helps prevent further spread. Post-exposure prophylaxis, which involves administering antibiotics and possibly a booster dose of the vaccine, is recommended for close contacts of infected individuals. By combining vaccination, public health measures, and post-exposure prophylaxis, we can effectively control diphtheria and protect ourselves and our communities from this potentially devastating disease. Prevention remains the best defense against diphtheria, safeguarding public health and ensuring a healthier future. Don't forget to subscribe, like, share for more videos. Thank you for watching.